My name is Chad Copper. I'm a general surgeon specializing in laparoscopic and robotic surgery at the Longstreet clinic. I'd always been interested in the medical field, but I got the chance to get my EMT certification, and I drove an ambulance for a couple of years while I was in college, and that kind of solidified my interest in medicine as well as my interest in surgery. Minimally invasive surgery has been around for a long time. Laparoscopic surgery started with the GYN surgeons back in the 80s. General surgeons picked it up in the early 90s, and it really caught on when we started doing what's called laparoscopic cholecystectomy, which is removing a gallbladder laparoscopically in about the early 90s. One of my partners, Dr. Lee, did the first laparoscopic gallbladder here at Northeast Georgia with one of the GYN surgeons, Dr. Lynch. We were able to do the same surgery we were doing open, yet we did it through little bitty incisions. And we took a surgery which used to put people in the hospital for about 4 days and out of work for 6 weeks, and we changed it to an outpatient surgery with 4 little bitty incisions, and people went back to work in a week. So it completely transformed a very common surgery. And so once that happened, it really opened everybody's eyes, and we started going into the late 90s and early 2000s figuring out, okay, what can we do with this? And we figured out we could do a whole lot. Robotic surgery is really just another form of minimally invasive or laparoscopic surgery. The robot is just a laparoscopic tool. The robot doesn't operate on its own. It doesn't go in there and do the surgery for you. Nothing moves unless I move it. The great advantage of the robot is there's about 3 things. Number 1, I can see things in 3D, which allows me to see so much better than laparoscopically. Number 2, laparoscopically you're operating with straight sticks. So there's a lot we can do with those sticks. We can, move around and do a lot of things, but it's in and out, up and down. With the robot, we've now taken those sticks and we put wrists on the end of them. So now anything I can do with my hands, I can do with that robot. So I can sew, I can, dissect very delicately. So it put wrists on the ends and really allowed us many more degrees of freedom than we ever had before. And allows us to get into spaces that we never got in before. And the robot allows us to do a lot of things, what we call intracorporeally. So that means doing surgery inside the abdomen, things that we would normally have to do outside. So bowel anastomoses, when I do colon surgery, I now am able to put the bowel back together on the inside instead of bringing it to the outside and stapling it or sewing it together, which is what we do laparoscopically. I can now do all of that on the inside. My philosophy on care is really treat others like you want to be treated. And I mean that in the most sincere way. I really try and look at every patient that I have as, if you're my sister, if you're my brother, if you're my father, if you're my son, what would I tell you to do? It's one of those things that I really try and concentrate on. We try and take care of everyone as if they're a family member. And the Longstreet Clinic really fosters that as well, because it's such a family atmosphere, both with the staff and all the doctors that work together, and people that get their care here, they get all their care here. My family's extremely important to me. That's the most important thing to me. If I'm not here, I'm doing something with my family. I've got 2 boys who are 13 and 11 right now, and they keep my wife Nancy and I very busy. And whether they're paddling, kayaking, playing football. So if I'm not here in the operating room, then I'm probably on a field or in the lake somewhere with the boys.